My name is Stefani Falcones Torres. My theme is brain. Definition: the brain is the control center of the human body. It receives information from all the parts throughout different nerves. An adult human brain weighs about 1.4 kilograms. It is protected by a hair-bony skull. Application in medicine, neuroscience, are a set of scientific disciplines that study the structure and function, development of biochemistry, pharmacology, and pathology of the nervous system, and how the different elements interact, leading to the biological basis of behavior. Technology paved the way for understanding how brain works, enable researchers to understand and see inside the brain. Brain scanner develop brain imaging technology, magnetic resonance imaging, positron emission tomography, radioactive glucose used to determine activity in different parts of the brain. Electroencephalography electrodes give us reading about electrical outputs of the blood.
The brain is the origin of human behavior. By studying the physical circuitry, you can actually begin to understand how the brain works.
Neuroscience is trying to answer questions about the brain and the nervous system from any angle, every aspect. Computer science, chemistry,
Physics, philosophy, biology, psychology, all of those fields have come together to help us understand how the brain works. A person who majors in neuroscience can enter the biomedical industry, working in a laboratory or being a lab manager.
science education, science writing. I'm a really curious person and I want answers. Neuroscience allows me to explore the questions that I have, the concepts that intrigue me, and contribute to what's already known.
Advantage pro, no cons. The frontal lobe, this charge of controlling personality, emotion, reasoning, and muscle movement. Parietal lobe, his charge of sensations such as touch, heat, and cool. Temporal lobe, charge of the hearing, language, speech, smell, tasting. Occipital lobe, manager of vision. Cerebellum, charge balance of muscle tones. Brain stem, control breathing, movement, and reflexes.
Hello and welcome to another episode of Interactive Biology TV, where we're making biology fun. My name is Leslie Samuel, and in this episode, episode 27, I'm going to talk about the three parts of the brainstem and what their functions are. So let's get right into it. Now here we're looking at the human brain, and here we'll see we have the spinal cord, and the spinal cord enters the skull, and where it enters the cranium, the skull, it then becomes brain. And the first part of the brain that we enter is called the brain stem. And the three parts of the brain stem are the medulla, which is this section here, and then we have the pons, and we have the midbrain. So the medulla, pons, and the midbrain, those are the three parts of the brain stem. Now let's look at the functions of those three parts. First we have the midbrain, and that's involved in processes such as vision, hearing, eye movement, and body movement. Then we have the medulla, and that is involved in maintaining vital body functions such as breathing and heart rate. So you'll notice these are the autonomic processes. In other words, these are the processes that are going to happen whether you think about it or not. These are regulated by the medulla. And last but not least, we have the pons, which is involved in motor control and sensory analysis. So once again, we have the midbrain, the medulla, and the pons. And these three parts make up the brain stem. That's it for this video, and I'll see you in the next one.
Disease, meningitis. It is a bacterial infection of the membranes covering the brain and spinal cord meninges. Causes. The most common causes of meningitis are viral infections that usually get better without treatment. However, bacterial meningitis infections are extremely serious and can cause death or brain damage even with treatment. Meningitis can also be caused by chemical irritation, drug allergies, mushrooms, vermin, tumors. Symptoms. Viral meningitis occurs more often than bacterial meningitis and it's milder, usually occur in late summer and early fall. Most often affects children and adults under 30. The bacterial meningitis is an emergency and immediate treatment is needed in a hospital. Symptoms usually appear quickly and may include fever and chills, change in mental status, nausea and vomiting, sensitivity to light, photophobia, severe headache, stiff neck.
Meningitis. Introduction. Meningitis is a very serious infection of the fluid that surrounds the brain and spinal cord. Meningitis can be fatal. However, if found early, it can be treated. This patient education program will help you understand what causes meningitis and how it can be diagnosed, treated, and prevented. Meningitis. The brain and the spinal cord are the command centers of the body. They allow us to speak, hear, understand, see, move, feel. A clear fluid called cerebrospinal fluid, or CSF, surrounds the brain and spinal cord. CSF is a clear fluid that looks like water. CSF acts as a shock absorber and protects the brain and spinal cord from injury. Membranes called meninges protect the brain, spinal cord, and CSF. Meninges help prevent CSF from leaking to the outside. Meningitis is an infection of the CSF, the fluid surrounding the brain and the spinal cord. People sometimes refer to meningitis as spinal meningitis. Causes. Bacteria and viruses are organisms that can infect the meninges and CSF. When a virus infects the CSF, it is called viral meningitis. When bacteria infect the CSF, it is called bacterial meningitis. Bacteria are bigger than viruses under a microscope. It is important to know whether meningitis is caused by a virus or bacterium so it can be properly treated. Viral meningitis is usually less severe and may need no specific treatment. Bacterial meningitis can be quite severe and may result in brain damage, hearing loss, or learning disability if not treated early. For bacterial meningitis, it is important to know what type of bacteria is causing the meningitis. Antibiotics are essential in treating patients with bacterial meningitis and can also prevent some types of bacteria from spreading and infecting other people. Symptoms.
Treatment. Antibiotics to treat bacterial meningitis are used depends on the specific type of bacteria causing the infection. Antibiotics don't treat viral meningitis. Antiviral, they can be administered to persons with herpetic meningitis. Other treatments include intravenous medicines to treat symptoms such as brain swelling, shock, and seizures. Disease. Hydrocephalus. It is an accumulation of fluid inside the skull, leading to brain swelling. Hydrocephalus means water on the brain. Cause. Hydrocephalus is due to a problem with the flow of the fluid around the brain, which is called cerebrospinal fluid or CSF. This surrounds the brain and spinal cord and helps cushion the first. 2. LRC puts pressure on the brain, which pushes him up against the skull and damages brain tissue. Hydrocephalus may start while the baby is growing in the womb. Symptoms. Hydrocephalus symptoms depend on age, the amount of brain damage, what is causing the buildup of CSF in infants with hydrocephalus. This causes the fontanelle soft spot, the body and the head to be larger than expected. Initial symptoms may also be eyes that appear to gaze downward, irritability, seizures, separated sutures, slimness, vomiting.
Hi, I'm your host, Jesse Singh, specialist in cardiosurgery. Welcome to Medicine for You. Today we will be talking about hydrocephalus with Dr. Tully, neurosurgeon.
Hi, thanks for having me on your show.
No problem. Could you please tell us what exactly hydrocephalus means, Mark?
Well, first of all, let me break this word down for you. Hydro coming from the Greek meaning water, and cephalus coming from also meaning brain. Now, it does not necessarily mean water on the brain or water in the brain. It has to do more with the accumulation, extensive accumulation of the cerebrospinal fluid in the ventricles in the brain.
Thanks. What are the symptoms of hydrocephalus, and how could you know if a person had hydrocephalus?
Good question. Well, basically, an individual who has hydrocephalus is an individual, mainly an infant or a newborn, who can simply not look up at the ceiling or sky, and we call this sun-setting eyes. Other possible symptoms may include drowsiness, vomiting, but not any ordinary vomiting, but projectile vomiting, where the vomit from the child's mouth reaches the ceiling or something like that. The classical symptoms for hydrocephalus is where an individual's head is unproportionate to their body. Back to you, Jesse.
Thanks. What is the treatment and diagnosis?
Basically, the diagnosis is fairly simple. All we have to do is get an MRI scan. Again, an MRI scan doesn't really help us. All it really does is just tell us a little bit about, give us a better view. It doesn't really tell us how to, do things, change the way we work, basically. And the treatment is fairly simple as well. All we have to do is drain that fluid to another part of the body. It could be the lungs, the heart, it could be the stomach, the liver, wherever it gets absorbed by the blood.
Thank you for your contribution, Dr. Tully. I am Jesse Singh, here with Dr. Mark Tully. from Medicine for You. Goodbye.
Treatment. If there are signs of infection, antibiotics are given. For serious infection, it may be necessary to remove the shunt. A procedure called endoscopy, clear ventriculostomy, which relieves pressure without replacing the shunt. Excision or cauterization of the part of the brain that produces CFF. The child will need regular checkups to make sure no further problems. Regular tests are done in order to check the child's developmental level and looking for any intellectual, neurological, or physical problem. The visitor, social service, support groups, and local agency nurse can provide emotional support and assist the care of a child with hydrocephalus who has significant brain damage. Thank you. This is my presentation.